All aspects of a patient's healthcare record should, of course, be secure, up-to-date and readily accessible. Monnie's software solution provides real-time access, updates and functionality, as well as a full view of every organisation involved with the patient and their history.
Father and daughter Mick and Kimberly know only too well how vital it is to share information among health and social care systems. Each has struggled to get the right care for a loved one. Each has become increasingly frustrated when key information hasn't been passed on. Kimberly's son, now 8, has been diagnosed with a range of conditions, including severe Asperger's, ADHD and pathological demand avoidance. Kimberly wants to protect her son's identity, but use her experience of navigating the systems, including the child and adolescent mental health services, to help improve future communication.
I just felt helpless, and I wanted to do something for my son. We need a solution across the local authorities, CAMS, NHS, all of the departments under the Department of Health to work together so that information is freely shared. It can be accessed at the touch of a button. The coordination will be so much easier if everything is centrally made available.
When a child has complex needs and conditions, as does the boy whose room this is, then sharing information between his health and social care professionals seems fundamental to ensure he gets the best and most efficient support.
The boy's grandfather also wants better sharing of medical information. The wife he met when she was just 15 is now incapacitated with dementia and other conditions. After much heart searching, the family put in place a do not resuscitate order. But when she was taken to hospital with severe pneumonia, the form did not go with her.
And I said to them, I thought we had a form to say that do not resuscitate if it got to this situation. We haven't got that form. Because they didn't have sight of it, they resuscitated her.
One of the pioneering systems working to bring together patient data is called Monnie, with the Fiorano integration engine. It's already harnessing information across NHS Wales, running on the secure NHS N3 network. It can also connect with existing systems.
Social services have been isolated on its own. Acute hospitals are isolated, GPs are isolated. All of that information needs to be pulled together.
Agnes Goff designed the Monnie system for very personal reasons. Her brother committed suicide after being released from hospital with no backup care. And her grandson was born with problems that could not be treated in a new area because his records had not followed him there.
For me, the key driver for this was to help the end person. So having that information all in one place where informed decisions are made based on your history and the whole holistic picture is so key. You know, I don't want to have to explain my grandson's or my brother's situation time and time again. My youngest brother's terminally ill with cancer and my mother has to tell that story every time they go to the hospital. It breaks their heart.
The big difference between our system and most of the other systems on the market, in fact probably all of them, is the unique aspect of the peer server configuration. The big effect of that is that you can actually move far more messages faster, and so that bottlenecks don't occur.
Joining up the information so that all the services a patient needs are in the know about that person will make for a more efficient and more effective health and social care system.